I'm going to introduce Jess March and Lucy Bradwell from the Public Health and Communications Management Team of Calderdale Council. Is that about right? Somewhere close? Oh, I'm going to look as if I know what I'm doing. Right, well, I'm going to hand you over, and then I'm going to have to disappear somewhere else, and Julie's going to pick up the baton, or at least the mic, from here on in. Okay, over to you, ladies.
Hello everybody, my name's Jess. I'm part of the Public Health team at Calderdale Council. Do you want to introduce yourself, Lucy?
And I'm Lucy Bradwell, Communications Manager for the Council. Thank you for inviting us to this.
Yes, I echo that. What I propose to do today is we haven't got a huge amount to tell you or talk to you about. What we're really here to do is to listen to you. I'm sure either Malcolm or Julie have told you we're here to talk about the COVID pandemic. And I'm going to give you some very brief information about the COVID levels in Calderdale at the moment and the sort of the picture, the context that we're all living in. And then we've got a few questions really that we'd like to ask you, and as I say, we're very much here to listen today rather than to impart information. So in terms of how the pandemic is at the moment, you may be aware that there's been data published on lots of different websites, including the council website, about case rates and things like that in the past. Well, the data that's being published at the moment is very unreliable because, as I'm sure you're aware, that the testing for COVID is no longer mandatory for people to be tested. So very few people are actually undertaking tests now. So the testing data is very unreliable. So we're left with sort of estimates of what the case rates are. And so the latest data is showing us that we think that the COVID rates have peaked in the last few days, sort of in the West Yorkshire area, and that the COVID rates are now levelling off. But they are levelling off at a high level. So the pandemic hasn't gone away. There is still a lot of the virus circulating and transmitting amongst our communities. And the estimate at the moment is that about 1 in 12 people in Calderdale have COVID. In terms of our local NHS, we have slightly more reliable data because obviously we can keep track of the people that are being admitted to our hospitals and that are tested positive in our hospitals. And the hospitals, the Calderdale and Huddersfield Foundation Trust was under significant pressures over the Easter weekend because of staff being off, either because they've got COVID or because their children have got COVID, but also obviously the people in hospital with the virus. So there was significant pressures in our local hospitals over Easter. But over the last week or so, we think that the bed occupancy and the admissions in our local hospitals has reduced slightly. So it is the amount of people, the numbers of people in hospital with COVID locally has come down over the last week, which is really good news. However, what we have seen is a slight increase in the number of people in intensive care that are being treated for COVID. So just a very slight increase there, so we keep having to keep an eye on that. So the picture is still a bit grim locally. This virus hasn't gone away. We are still living in a pandemic. And the things we need to remember, that sort of the public health message that I'm sure you're all very familiar with now around hand washing, 2 metre social distancing, wearing a face covering in indoor settings, they remain the advice that we continue to give out to people. So while some of these things are no longer mandatory, so they're not legally enforceable, we are still strongly advised to continue with these measures. And the other thing to remind everybody is that the vaccination is the way out of this pandemic. So you may be aware that some people are being invited for a spring booster. So that's people who either are immunocompromised, so their immune systems are suppressed, or if you're over the age of 75, people will be invited or have been invited for a spring booster. So we continue to encourage people to take up that booster if they're invited for one. So really that's sort of the information that brought us to where we're at in terms of COVID. Does anybody have any particular questions about that? I may not have figures that I can give to you today, but I can always take away a question and share answers with Julie.
We've got a question from Teresa at the back first, and then I'll come to Michael after Teresa. Did you have a specific question on COVID, Alison?
Yeah,
Right, sorry about that, Teresa. Alison put her hand up first, so we're going to do Alison first, and then I'll come to Teresa, and then Michael, and then over there in the corner, I've forgotten his name. Alison. I've got to get these steps in. I knew I've got to 10,000, so... 7,000.
Hi, so my name's Alison Schofield. I've been a publicly elected governor at Calderdale and Huddersfield Foundation Trust for about 5 years now. So I sit in a lot of board meetings and decision-making panels. And it is very true that COVID is still around. It was just the case of people who were vaccinated has meant that less people are needing intensive care. But even when they have a drop in COVID admissions, they've then got a huge backlog of other work, cancer work, other operations to get through. So basically we should all still look after ourselves, follow all the precautions, but I'm finding it's extremely difficult to know how to book a booster, to know that you should be wearing your mask, or to access the lateral flow things because they've made it it's not public enough anymore, so it's made everybody believe it's gone away, if that makes any sense.
I completely agree with you. We are facing, it's almost like mixed messaging, because what we notice now is that sort of national messaging is reducing, so that it's not mentioned as much on the news anymore. Obviously the national mandates have changed, so there's no legal requirement to do things, which gives the impression that that this pandemic is over, and it's not. So in terms of the vaccination, people who are eligible for the spring booster will be contacted. So you don't need to sort of go and seek it out. If you're eligible for that booster, you will be contacted by the NHS. And in terms of the face coverings, again, as I say, it's not mandatory anymore, but the advice continues to be the same as it was previously. So if you are in an indoor setting where you're mixing with people that you don't live with, then the advice is to continue to wear a face covering in that situation. But as I say, it's just advice now and not a legal mandate. But I completely agree with what you're saying. And we are seeing that in our local hospitals that it is having an effect at the moment on the recovery of elective care.
Okay,
Thank you.
Teresa?
2 quick questions. Will a diabetic have the spring vaccination, even if they are under 70 years old?
I'm not completely sure about the categories of who's being invited at this stage. I believe it's just people that are immunocompromised and people over 75. So I don't think for this round of boosters, if somebody was diabetic and under 75 and didn't have anything else that compromised their immune system, I don't believe that they would be invited, but I'm not 100% certain about that. But if you are eligible, I repeat that you will be contacted by the NHS to book it.
You were mentioned about wearing a face mask. Now is it still mandatory over in London? Because I'm going to London in June.
No, it's not mandatory anywhere in England now.
Also, we don't have to wear them anymore.
No, you don't have to legally, but we continue to give the advice that you should if you're in an indoor setting with mixing with other people.
Okay, thank you.
Thank you. So actually we're all not being very good, are we? And I've just noticed that we all need to wash our hands, because you've just passed the microphone to Teresa and you've just passed it back to me. So I am going. I did a negative test this morning, but just in case, gel your hands. And I'm not going to hand this to anybody else now. I'm going to keep hold of it just to minimise. So Michael, you're going to talk into this microphone and ask that lady your question.
I reckon that they've opened the country too fast.
Open the country too fast.
They've relaxed things. Lots of people feel the same, Michael. Lots of people feel the same way. I think it's right that we started to reduce the restrictions, because we have to learn to live with COVID, but they have relaxed things quite quickly.
Thank you. Okay, so any more questions? If not, ladies, oops, I apologise. Sorry, yes, you did put your hand up to this side.
On public health,
have you been into the shops to ask about, you know, why certain shops have removed their notices to say, you know, you can remove your face masks? Have you had any consultation with services?
It's come down from national government that has.
Are you talking in reference to lip reading for shops?
No, it's just about the numbers that have increased, that's all. Yeah.
Okay, thank you.
And then the second part of this question, I'm happy to carry on to wear my mask, and people laugh at me, and I just ignore it really. You know,
That's the right thing to do.
I'll just add on that point, we actually still have a stock of the clear masks and the visors that we're giving away free of charge to anyone that wants one. So if you need to lip read in a shop,
it's fine.
right. Well, if anybody else wants one, just to let you know, Nikki does send them out to anyone that wants one still, free of charge. I've got another question from this gentleman.
Yeah, I use my mask when I'm on the bus. It's up to other people whether they want to wear their masks or not. You know, I mean, you look at people that are holding on to handles and things like that, but I still wear my mask. And I will carry on, it's there in my pocket. So, yeah.
Well done. That's exactly as we would advise.
Okay, Jess.
Okay, I'm kind of going to hand over to Lucy then. Now, going to hand over to Lucy, because what we'd like to do now is to hear from you guys and to ask some questions. So really, in terms of the reason for coming is we'd like to hear about how you're feeling in terms of the COVID pandemic and how it's impacting on your lives going forwards. We understand that there are people within our communities in Calderdale who are a lot more cautious about being out and about mixing with other people. Now people are potentially not getting tested as often and not wearing face masks and not socially distancing. So we're keen to hear about from you guys about generally how you're feeling about the COVID levels and how it's impacting on your lives, and what you'd like the rest of the public to know about how you're feeling. So I'm going to hand over to Lucy now.
Thank you. Did you want to come in, Julie?
I was just wondering, was there another question from this side?
Just to clarify, your advice, you work for the council, is that correct?
Yes, that is correct.
For the government?
We work for the local authority, the Calderdale Council.
Okay, just to clarify. Because I went to Boots chemist and I asked for a box for the testing kit, and they haven't been giving me up to press. And I asked for some more, and they said that they stopped providing them. Why have they stopped providing them now? Why can we not get hold of tests now? The lateral flow test, sorry.
That's come from the national government's directive.
Nikki, do we still have the lateral flow tests that the council gave us? With none left?
Hardly any, I'll have a look, but hardly any, because, like I said, people, when they start to charge, we've got lots of people ask for them.
Right.
Yeah.
If we have some, would you send some out?
Yeah, have a look when I get back. Yeah. When they start to charge, I've got lots of people contacting, I haven't got any left.
I mean, I can't purchase them, but Boots has said, no, you're not. Boots has said you're not allowed to purchase them. Boots has said they're not allowed to purchase them now.
You should be able to purchase them. It may be that they perhaps run out of stock, but no, you should definitely be able to purchase them from pharmacies.
Okay, thank you for that.
Thank you. Okay, back to Lucy, sorry.
Thank you. So I work for the communications team at Calderdale Council, and throughout the pandemic we've been putting out communication, whether through the media or through posters or through our social media feeds, to explain what the current position is. So we've been talking about those laws that came into place that meant that we couldn't, at the height of the pandemic, mix with other people. Since the restrictions lifted, we're obviously in a very different place. As Jess has said, COVID is very still with us, and it's still quite high levels. But we don't have those messages about how to keep ourselves and other people safe that are actually legal, that we can police. So now it's a case of trying to encourage people to do those things that will help keep each other safe. So it's a very different position, and I think, as Jess said, it's right, because we've had 2 very difficult years, and I think we're all sick and tired of talking about COVID. I know I am. But it does mean that we also can't forget that COVID is around, and it's still making people ill. So what I was really hoping you'd be happy to share with me is, as Jess said, how you currently feel, because it's a very strange time. There is this virus that can make us ill, but we also don't have those laws in place that mean that it's somehow stopping the virus spreading. So what I wondered if you'd share with me is how you are feeling. Are you confident to go outside and spend time with other people and come here and not worry? Or are there things that do concern you? And is there anything that we can put out in our social messages that share your experience and maybe persuade people or encourage them to understand how everyone in the community is feeling? It's not something that we necessarily have talked about so much, because it's been everyone in the same position. But people, for example, who have a suppressed immune system may be feeling differently about it. There may be some anxieties about it. And those are the things that I'm interested in hearing about, and possibly also whether you'd be happy to share, for me to share that through the social media accounts, to encourage other people to think and understand how other people in the community are feeling.
So, I guess I'll come to Donna and then the gentleman. I just wanted to share some anecdotal feedback that we've been listening to over the past 2 years, and one thing that my personal opinion is that might work is saying to people, pulling on their heartstrings, how would you feel if this was your grandma or parent or child that has cystic fibrosis or whatever it is. So although it's not mandatory anymore, if someone can relate to a person that says, I'm still frightened because of this will make me poorly. It might not make you poorly, but it makes me poorly. Please be respectful. Pulling on people's heartstrings and that human element might, I'm sure you've heard all this before, but I'm sure that's the sort of thing. Do you agree with that? Perhaps that might work. Anyway, I'm going to come to Donna first, and then go to the, I'm sorry I don't know your name. Sam. Donna, I'm not going to give it you, I'm going to hold it.
Right, just what you just said there, we've tried asking people that we've been in areas with, because we mask up wherever we go. I know I'm sat here without, but I've been eating. Anyway, and people have guffawed at us and they said, oh, well, it's not going to bother us, is it? We're not going to get it. Well, no, it's not, but I've had it twice. I'm a vulnerable person with lung problems. I wasn't coming out the last time I went in. I was that close. And I cannot express my anger at something I heard on Saturday. We were at a wheelchair rugby league game where my husband was refereeing, and one of the players at Bradford quite openly told me that he'd seen somebody that he knew done a lateral flow test. It had the 2 lines on it, and I swear to God, I'm sure he's telling the truth because he's not thick enough to make this up. The guy got a cotton bud, put it in his ear, wiped one of the lines off, and it just disappeared. Now, he sent that lateral flow test to his boss and he says, right, you can come back to work, and he knew full well he had COVID. That angers me.
And I can understand that. And
These people know how to do that. What other stuff is going around that make it so easy to make a test do the opposite? I mean, when it's a pregnancy test, you can sort of think, oh, well, never mind, it's a baby, good, you know, it's all going good, but COVID's a killer. You know, I mean, had it really bad twice. They've said now, if I get it again, I could be dead. I will be dead. But that's made us not go out a lot, apart from when he's doing his referee. I sit there masked up and I don't have anybody around me. He's running around the side of a pitch, but he can't wear a mask. So we've always got sanitizer, we've washed off. I'm surprised I've got any skin left. You know, I'm scrubbing and doing all this, and I'm sure a lot of other people are, but when you live like we've had to live this last, I'm filling up now, this last 2 years, it's been an absolute hell. And I don't want other people to go through what I went through. People need to learn and do what we're supposed to do. Pass it on, please.
thank you for sharing that. I mean, that is exactly the sort of thing that I think is very powerful. And we would like to tell that story because it's very easy for people to be blasé about the virus if they are not so directly affected by it that even if they caught it, it holds very little fear for them.
I came that close to actually using my crutch on that man on Saturday because I know what he's like as a person and we avoid him like the plague. He's caused a lot of problems within the rugby league and the wheelchair games itself because he's an idiot. But he was bragging about his friend and he was like sat. He was still, so I moved back so he was away from me. But I had to put my crutch in between my legs and go like that because I just wanted to knock him out because he thought it was funny.
I just wonder why somebody like that took the test in the first place.
Well, exactly. But it wasn't him that did the test, it was his friend. And I just think, I just said to him, that's not even funny. Bugger off, I don't want to hear it. Go away. Be an idiot with your mate, but don't come round here and spread that around. You could have it for all we know now. So we've gone over, we've done tests and we're negative. But if I have to stick one more thing up my nose and in my mouth, I think I'll just close up. I've done that many tests, I don't think I can do them anymore. I'm sore. You see that, it's just not pleasant. And for people to abuse the whole theory of why we have to do it, it just angers me. My anxiety levels are through the ceiling thanks to that bloke on Saturday. I was just starting to feel better. Now I'm not. Thank you, Rhett. Sorry, I shut up.
Thanks, thank you, Donna.
And I really appreciate you sharing that because it's I can tell it's very, very hard for you to talk about. One of the things that, I'm hoping for some guidance from you about how we can address this through our communications. One of the ways which we can do it is to film you telling your story. Now that's quite a big ask and it's a very personal thing.
I do it.
I mean, that's perfect.
I do it.
So if we, I'll take your details and we'll come back to you to do that.
I'm going to be bored soon.
She is for charity, she is actually.
You're shaving your hair
We're
off
trying
for
to fit
charity.
it in.
This is what they say, it's lockdown hair. I'm growing it specifically to shave it off for everybody.
So she's shaving her hair off for MND.
I'm going back fully bald.
We need to cover that story in our newsletter,
It will
Phil.
be filmed.
Get people to donate to that wonderful cause.
And we'll do it once straight at a rugby match. I want to be the half-time entertainment. Because it will be bloody entertaining, won't it?
Okay, so I'm going to do Sam, then Teresa, then the gentleman in the corner, and then this gentleman here, and then Michael. I've seen you all, so you don't have to sit with your hands up. Okay, Sam.
Oh yeah, well, I was going to say all the groups I was volunteering with, none of them have started again yet after COVID, and not one of them is Council's Countryside group. And all the this is only the second time I've sat in a room, apart from going shopping or sitting on the bus, with humans. Everything's still on Zoom. Like all the other disability sort of peer support groups, everything's still on Zoom. And yeah, as far as the rest of the world's concerned, the plague's still happening. Yeah.
Yeah, and I think, I mean, the council itself is very cautious because we understand how high the levels are. As Jess has said, this is one of the few meetings that I've been into in the past 2 years with real people. There does seem to be a marked contrast between some groups and the rest of society, and I wonder how long it's going to take, because while levels are high, it's certainly from the way I personally feel, that feels right to me.
I'll just say on that, we did a risk assessment and we decided that we could open up because of the size of the room and the high ceiling and the ventilation that there is, and there's the space for people that don't live together to sit 2 metres apart. We let people know that they can come if they want, but we have 500 members and film videos of the meetings which go online, so there's a lot more people would normally be here that are not here. They'll be watching it at home at a later time. And again, if you want more information, I'm sure there's lots more people watching at home that have also got stories to tell you. So we can gather that for you and pass it on anecdotally once we get it from you. So I'll pass you on to Teresa.
Got the football matches still going on, things like that.
Yeah, and we'll come over that corner after Teresa and then this gentleman after that.
They said even if you do have COVID, you can still go to work. You're not isolated for 10 days anymore. It's a bit strange, that, isn't it?
Correct, yeah. Obviously there is no requirement to people to isolate anymore, and it's not a legal requirement. But what we're recommending is that any adult who tests positive or who has symptoms of COVID stays at home if they're able to for 5 days. For children it's 3 days. So yes, you're right, there's nothing to enforce that. People can go to work, they can do a lateral flow test, they come up positive and they can go to work legally. But obviously our advice is that if you're feeling unwell with COVID symptoms, or if you test positive, as an adult you should stay at home if you can and avoid contact with other people for 5 days. And for children it's 3 days.
I struggle to wear a face mask because it's so big on my face. It goes up my face and underneath my eyes, and it's making it hard work. So, what can I do?
Have you tried a smaller face mask, a children's size mask?
I haven't tried a children's one, but will that be too small, or do you think it'd be alright?
I think you'd have to just try it and see if it was comfortable.
I'll have to go then, see if it's better for me.
Thank you. Come into this corner. I'm going to get my steps in. 7,500 I've done so far.
More steps.
Recently.
Oh, yeah. With public health, regarding how many deaths and how many people have contracted COVID, when are they going to be, there's been nothing announced like you said earlier, is there going to be an announcement of what the statistics will be, of how many deaths recently and how many people have got COVID?
In terms of how many people have COVID, it's really difficult to measure now because people aren't taking the tests. So there's very little reliable data about that. And in terms of the deaths, I think some information is published still on the council website, is it? Yeah, it won't be as updated as regularly as it used to be because we don't get the same level of reports. We used to get reports on a daily basis and we don't get that kind of information.
I've been isolated for 2 years. And there's a lot of people out there, a lot of deaf people that I know of, that are very depressed because of the isolation. And I've got family who are trying to encourage me, to keep myself fit at home, keep myself active. When I go out, I have panic attacks. I panic. So I decided now to get out early in the morning and come home, before everybody comes out of their homes and come home early afternoon. And because it's constantly on my mind. Because, when the numbers increase towards the afternoon, I just want to back off. There's too many crowds in the town centre.
Could I ask if we can share that story too, because it really paints a picture of how some people are feeling and what their experience has been over the past 2 years and continues. Fantastic.
Any more from this corner? Any more questions from?
One of Billy's ideas was maybe, he says, you might think it's funny, but they do the breathalyzer test when people have been drink driving. Maybe we should introduce that, where they do have to do a breathalyzer test that detect COVID.
And send them home.
Do you know, I'm going on a cruise in June, and they told me and my husband we have to do a lateral flow at the port, and if it's positive, we can't get on the boat. Even though our suitcases will be on it. So they do, a bit, sort of. Hello? Right, I'm going to, where was I going? This gentleman here, and then there was another one, and I've forgotten where I was going now. My memory's like a goldfish. That's a quiz question in the quiz later on, by the way.
I agree what this lady was talking about earlier on, people being COVID. I find a lot of people going on a bus got COVID, but they keep quiet. And I think the bus drivers should stop people completely. And also, I know some people on the charity shops, there are about 10 people in the back, one of them got COVID. They start making them work like donkeys.
Sorry, I'm not hearing what you're saying there, sorry. You just repeat what he said.
So then lots of people are going on the buses in the shops and they've got COVID and they're just still doing it anyway.
Even the charity shops.
Even the charity shops.
Working in the back.
Working in the back.
And then one of the loved ones get sick.
And then they wonder why the loved ones are getting sick.
Yes, unfortunately we do hear stories like that. Because there's no legal requirement, so that employers can insist people go into work and people can choose to go to work even if they know they've got symptoms. What we're asking people is to think about, as Lucy said earlier, they themselves, it might not worry them if they get COVID, if they pass it on to the partner or something like that. They're low risk, they don't feel particularly worried, and what we're asking people to do is think about others. You'll probably be aware that one of the things that we recognise about the Calderdale population is their innate kindness, and so we're sort of trying to tap into that and ask people to be considerate and to think of others. So by coming today and to speaking to you guys, we can make it real, rather than just some words on a page coming from somebody like myself or somebody like Lucy. What we want is it to come from people like you who are experiencing this. It makes it more real.
It's just occurred to me, you can headline this, whatever you